Psychosis is a state of mind where the line between what's real and what's not real becomes blurred. Psychosis can happen at any stage, but most commonly in our late teens or early 20s. The common symptoms that we see in psychosis are hallucinations, usually in the form of hearing voices, delusions, thought disorder, which is a negative impact on our ability to think clearly, cognitive deficits, things that have an impact on our attention and our concentration. And you can also develop negative symptoms, which are like depression, not getting the same enjoyment from things in life. Not everyone develops all of those symptoms, and a person's experience with psychosis is often very individualized. The most important thing to remember about an experience like this for the first time is that it's all brand new to you. It can also be quite a frightening or unsettling experience if it happens for the first time, which is really why it's so important about being able to get help quickly that you trust and have confidence in. Schizophrenia describes a type of psychosis where the symptoms have been present for longer than 6 months, and the symptoms have had a significant impact on day-to-day functioning. Psychosis can be a symptom of many other mental health difficulties. For example, with bipolar disorder, depressive disorder, early psychosis, drug-induced psychosis, and also with organic psychosis. There's no single cause for psychosis. It's usually a combination of different factors coming together, and the important factors are biological factors that might be to do with our family history, social factors to do with our environment and what we're dealing with at the time, and psychological factors often to do with the level of stress that we're under at the time. It's also important that if we have a concern about our vulnerability, to avoid use of substances that are likely to increase the risk. There are effective treatments available for psychosis and for schizophrenia, and what works best is a combined approach where we look at psychological treatments, often cognitive behavioral therapy, and also look at medication. Inpatient care is sometimes needed for psychosis, and if it's the right thing for you at a particular time, it's important that that support be put in place for you. The first thing to do is to have a discussion with someone who you trust. It can be a family member or a friend. It can often be really helpful to talk to your GP because that provides a way that you can sit down with someone in confidence, and also GPs are very well placed to be able to advise on what's available. It's often the case if we develop symptoms of psychosis that it's the people around us and the people that are closest to us that see that first. It can be very difficult in those circumstances to hear from someone who's concerned about you. It's important to remember that their motives for doing that, which are often to want the best for us. If you're looking for more information about psychosis, you can look at our website, walkinmyshoes.ie, or you can also make contact with our support and information service at St. Patrick's Mental Health Services.